So Sarah Beth, could you tell me a little bit more about what's been going on lately?
Sure. So this all started getting worse. Basically, after we left my ex, he was abusive towards me and my children, and I just couldn't take it anymore. We ran away, and I'm struggling to find a job ever since. I worry about everything all the time, and I just can't get myself to get out of bed and do anything about it. Just it's so hard, and they're going to take my kids away unless I do something, so I guess
Yeah, yeah.
that's
That sounds incredibly hard. I have to say I'm really glad to see you here in therapy with me, knowing how hard this has been and knowing that you've just got so much on your mind that it's really great to see you here, ready to work on how you can move forward with your life. This is terrific. This is terrific. And so you've been feeling depressed and worried.
Yeah.
Yeah,
All
and it
the
makes
time.
sense that you would be feeling these ways. And you mentioned kind of the urge to just get away
Not do anything.
and not do anything,
To just hide.
to hide.
I sometimes just want to sink in my bed and make everything go.
Right. And that is part of what happens with depression, right? When people are depressed, that's often what they will tell me, is that they have the urge to avoid, to hide, to stay away from the world, because it's just too difficult, isn't it, to get out into the world. So this makes tons of sense to me. And I'm wondering, was it difficult for you to get here today?
Yeah. So
Yeah.
it's just getting myself out of the house most of the time is a struggle, because I worry about all the things that might happen while I'm away.
Right.
Like my friend is with my kids and she's not very good at it. I
Yeah.
worry if I left something on.
Right. So worries about what could happen do they make you want to not leave the house?
It's that, and it's just hard to move.
Right.
It's hard to do anything.
It's hard to do anything. So between worries and depression and lack of energy, it's just hard for you to be willing to get out of the house, which I have to guess will make it difficult at times for you to come here.
Yeah.
And that I think we should actually just put on the table together and expect. And I won't be surprised, and I won't be judgmental of you, and actually won't have any negative reaction whatsoever if it's really, really hard for you to get here, because it makes sense to me it would be difficult for you to be here.
Right.
Yeah. And so what that could look like, if we just kind of, if we just sort of think about this, it's sort of like if you were trying to get a dose of medicine from a doctor and you knew that that medicine could help you, but it was so excruciating and difficult for you to get that medicine that sometimes you just didn't get it.
Right.
Right? And therefore you couldn't benefit from the medicine. So that's the thing I'm kind of thinking about with us, is I want to make sure that we can do the best possible work in here to help you with your depression and anxiety. And of course, we can't do that if you're not here. Right? So again, there's no judgment whatsoever of that. I think this is totally 100% ordinary and predictable, that if you're feeling so depressed and anxious, it might be hard for you to get here in this room.
Now I have to worry about that too.
Now you have to worry about that too. Right. It's like if you want to get better and there's a way to get better, then it gets to be another worry about whether you can find the energy and the time to be able to get that medicine.
Mm-hmm.
Yeah, makes sense. It makes sense. So it's possible that that's the kind of thing that could happen in here, that we may be working together, doing our good therapy together, and it might be that there are days when it's just too hard for you to get here, or it might be there are days when it's hard for you to leave on time, and so you might get here maybe a little bit later than the start of the session.
Mm-hmm.
I could see that happening, and I think it's useful here at the very beginning of treatment for us to put that on the table together, because we should really just think about what's going to be best to help you.
Right.
And when things come up in the room, and here, when things happen that get in the way of you getting the treatment that you want, those are things that we should probably just kind of openly talk about together.
Okay.
Yeah, it's sort of like if you and I are on a trip together and there's a roadblock in front of us, we should probably observe that roadblock is coming up together, rather than kind of pretend it isn't there and just ignore it.
Right.
So, are you with me so far?
Yeah, that makes
Okay.
sense.
Okay, so what I'm doing is I'm orienting you to what you might expect as we work together in terms of the types of things that could get in the way of your getting the care that you need and can get. So a different way to think about that is these are things that could interfere with your treatment, things that could interfere with your therapy.
So you're also expecting me to fail.
I'm expecting us to have difficulties that we can overcome together. I'm not expecting you to fail. I'm expecting us to work together to really see in advance what the likely challenges will be, and we'll work together to get over them. That's what we do. That's what I do with all my patients. I look to see what's going to happen in advance, and we talk about it openly like this. We plan, we problem solve, and when the problems come, we're ready for them.
Okay.
And it turns out, this is the kind of the trick to all of this, is that if we can figure out ways to get you to get here, to get your treatment, and if we can figure out ways in here for you to be able to really be engaged in this treatment, it'll actually help you change the way that you are outside of here. Right? Because getting here and all of the difficulty it takes to get here because of depression and anxiety, if we can solve those problems, we'll probably be able to solve similar problems for you. Maybe it's getting to see your friends. Maybe it's getting to see your daughter. Maybe it's getting to see, some of the people that really you care about seeing that it's just too hard for you to get out of the house to see.
Yeah, if I could get to work, that would be a big deal.
Yes, if you could get to work, that would be a huge deal.
I'm guessing if I could get here, I could get to work.
This is a very good point. If you could get here, that would help you get to work. So, we're seeing the potential for difficulty getting here as kind of a thing that if we can solve, it might be able to help you in other really important areas of your life. So that means that when these things come up, I might notice them in here. If you're late or if you don't show up, I'm not going to judge you, but I will think we should talk about it to try to overcome whatever the problems were.
Okay.
Is that something that you'd be willing to do in here with me in a very collaborative way?
Yeah. Most people just give up on it.
Most people give up on you, and I'm not going to give up on you. I'm going to dig in with you. I'm going to roll up these sleeves, and I'm going to dig in with you to help figure out what we can do to help you get better. Even if it means talking about missing appointments, being late, avoiding things like therapy that are just so hard for you to do.
Mm-hmm.
I'm going to care about you too much to ignore that or avoid that, okay? All right. This sounds like a good plan.